Welcome to the June edition of The Pulse. I'm Gary Paxson, and with me today is a special guest, Chad Graves. Chad is our chaplain for the organization, and it's a pleasure today to welcome you, Chad, and introduce you to our audience.
It's good to be here.
Great. So let's learn a little bit about Chad as an individual. So I know you're a pastor in a local church, and you've been in ministry for a long time, so kind of walk us through that journey.
Yeah, so when I was in the 11th grade, my pastor asked me if I'd like to help him. And I didn't realize that I was being introduced into ministry at that moment, but that set me on track to just work with our local church and be involved in ministry, and it led into campus ministry at ASU for 10 years, and then I was a pastor down in Monticello, led a church there, and so now we're here at Compass Church in Batesville. I'm a kind of a utility minister in some ways. I preach, counsel, help lead, do a little bit of everything there.
Great. Wife, and you have how many kids?
I have my wife, Julie. She's, I say I'm a flatlander and she's a hillbilly.
Okay.
I'm from Jonesboro area and she's from Mountain Home. She grew up in Monkey Run, up in the hills up there. And she works at First Community Bank as a graphic designer for their marketing department.
Oh, cool.
And then we have two boys. I have a son that's going to be married in a couple of weeks, Noah, 21. And he's just finished his first year in pharmacy. And so we're excited about what's going on in his life.
Yeah.
And then I have a son named Ethan, and Ethan's 16, and he just started UACCB classes this summer.
Oh, great.
And so he's doing great too. He's in the band and likes to sing. And
Good
boys.
So great community ties, passionate about the community and your job. And so we're excited to have you here. Talk to us about, you've been in the chaplain role for several months now. How's it going? What do you see is working well, and where do you see us going down the road with the program?
Well, there's certainly an adjustment to going from full-time to an assortment of chaplains, and so we've got 7 chaplains that are on call at night that are great guys that were here before and continued on, and those guys kind of represent different people groups from around the community, different denominations, and it's just good, like you say, community engagement. And then we've added another group of day chaplains, and I'm excited about all those different chaplains that, again, are just an assortment of different groups of people throughout the community. And so I think we have 16, and we're going towards 25 chaplains.
Wow,
is what we're hoping for, that will be working in either day or night, or in specific locations like maternity ICU, over where folks are going through chemo.
Sure.
Paul C. is that's kind of his area. He kind of shepherds and cares and chaplains that area over there. Wonderful. And so, yeah, I think that's a good thing to have so many different people involved in the process.
Yeah, absolutely. It's a great opportunity for us. You know, the care that's entrusted to us, and a lot of times patients are at a very difficult time in their life, and to really be holistic, we can't ignore the spiritual aspect of their care, and so we're thrilled to have this service that we can offer them. And
I appreciate the hospital having that sense of concern in that area of their lives, because people, every day, great things happen at this hospital. People come in hurting, they leave with real care, and then those that are hurting have family dynamics and just all kinds of things going on. And so to be able to walk in the room is a great privilege, to hope for people, care for people, to love people.
Yeah.
And so I think the chaplaincy work is a great work here at the hospital.
Agreed. We're thrilled to have you with us. Thanks for spending some time with us today. Get to know you a little better.
Yeah, thank you.
You bet. For the month of June, we have 2 great employees of the month to introduce to you for White River Medical Center. Tracy Barnes is a CNA that's been with us for 3 years. She works in PCU, and was represented for being involved. And Tracy, we thank you for being with us and being recognized for being someone who's involved in the great care that we give on a daily basis. Congratulations to you. And at Stone County, Phyllis Kendrick from Environmental Service has been with us for 7 years. Phyllis was recognized for doing just a great job of keeping the hospital clean. A beautiful facility, Phyllis. We appreciate you keeping it nice and clean. Makes a great impression for our patients and our visitors. We thank you and we congratulate you for being recognized. In the area of news and announcements, a lot of things going on in the month of June. June is National Cancer Survivor Month, and we certainly want to celebrate. There's a lot of new research and technology in our age that we can fight cancer in ways we never have before. We're seeing a lot of people survive cancer. We can catch it earlier, and it's a great opportunity for us to celebrate with those patients as they're able to beat that disease. And so we want to recognize that and celebrate with the many people we've been privileged to help fight such a devastating disease. June 4th, we're going to hold our first ever hernia screening session. It'll be from 4 to 7 in the conference center, Josephine Ray Rogers Conference Center here at the hospital. We invite you to come out and invite anyone who may feel like they want to have that screening done to make sure that they're not battling a hernia. If they want more information, Bailey Williams can offer that for you. Feel free to reach out to her. On June 6th at 9 a.m. to 2 p.m. we're holding a Safe Sitter class. We've done this in the past. It's a great opportunity for us to visit with young people who either will be home alone while caring for younger siblings or babysitting and look for signs of how to care for a child if they get into distress. And a great service for our community. Toy McMullen is leading that program, and if you have any questions, she can help you out and get you hooked up with that. On June 8th in Stone County, Raccoon Creek Crusher is coming up, and it's a great opportunity. It's a community engagement event. Great opportunity to encourage people to get out and live healthier lifestyles, and so we're sponsoring that, and we'll be participating in that event. Amy Finster is your contact if you'd like more information on that and want to participate. On June 15th, the WRHS Annual Golf Classic this year is 25 years. We'll be celebrating this year, and so I'll be out at the course at Eagle Mountain. We do need more volunteers. If you'd be willing to help, we'd sure appreciate it. And you can reach out to the foundation. They can help connect you if you'd be willing to help us out in this important fundraising event. Those funds are used to help us buy needed equipment for our organization so we can serve our patients better. We'd also like to extend a special welcome to Colleen Canfield. Colleen is our Director of Surgical Services. She's been with us for a couple months now. We're glad to have you here, Colleen. She came to us from Texas. It's great to have you here and help refine the OR, make sure we're operating at peak efficiency and serving our patients and our staff well. Lastly, I want to thank everyone. Employee engagement survey came to a close since the last time we met, and we closed at 85% participation. Went from 45% last year to 85%. Thrilled that you have recognized that we were serious about wanting to hear your voice. We're not going to tolerate retaliation, and that it's important for you to speak up. And so we don't have the results yet. We'll be looking at those next week. And just like last time, we're going to look at that information and figure out what we can do this year to make this an even better place to work for you. So thank you for all those that participated. Really thrilled with those results, and thank you for reaching out. That's all for now. A busy month. We look forward to moving forward. Have a great summer. We will talk to you again in July. Thanks for watching.